I start with the name of Allah, who is most merciful, beneficial and very kind. CME update by Mother and Child Survival Group of Pakistan. Update by Dr.Tariq M.Khan, Ops Gynae Family Emergency Specialist, now as a district gynecologist. Topic very important and very common topic: premenstrual syndrome. It is a symptom complex of symptoms related to psychological, physical and behavioral, and it is related before the start of the menses, and they are relieved when the menses starts and are better when they are going on. This is due to the ovarian trigger during the luteal phase activity. So this sometimes these symptoms are very distressing and needs to be addressed, and so distressing that they interfere with the life routines, activities of the patients, disruption and normal routines. Some 15% are asymptomatic, 50% are symptomatic, and 5 to 10% are very, very severe PMS. This PMS needs to be addressed and has to be dealt with. We take the detailed history, obstetrics and gynecological drugs, recreational drugs, relation of this with alcohol, cigarette smoking, and other histories, family history, past history, etc., etc., and then psychological history, economic history, personal history, and then we come to the symptom complex. And the symptom complex are basically the breast tenderness, swellings, headache, joint and muscle pains, bloating sensation and weight gains. And then there are some DSM-4 criteria is included, which have variety of at least 4 or 5 of the symptoms must be present in the luteal phase of all these. These are marked irritability, have a feeling of hopelessness, deprecation, distressing, persistence, anger, persistence, decreased concentration, decreased interest in life, and disruption of normal routine activities, decreased concentration, hyperinsomnia, and increase for food liabilities, and increase for eating habits. All these and the other symptoms we already discussed, that is bloating, breast tenderness and weight gain, and joint and body aches and fatigues, tensions, stress, depressions, hopelessness, helplessness, and tearful eyes. And these are symptom complex, and these DSM-4 criteria is applied here, and at least 4 or 5 symptoms are present in the luteal settings. Then how to manage these premenstrual syndrome, which can be so distressing, as mentioned, that 5 to 10% are very severe, interferes with their normal activity routines and daily activities, their interests, their habits, and their all normal routine functions. It is so distressing and psychologically anxiously, persistently disturbing feature for their normal carrying out their normal activities. The important are the hormonal treatment, progesterone and the progestin with suppository ointments, tubes, injections, and implants, and then comes the meta-analysis has proved their benefits, and then comes the ovulation suppressant, because ovulation is the trigger event which leads to what, the cascade of symptom complex, and initiate the chemical messengers basically, which are estradiol, estrogen, progesterone, GABA and serotonin. It's a combination of all these triggering events due to the ovarian trigger in the luteal phase. And ovulation suppression agents like combined oral contraceptive pills, the 4 RC trials have proved their benefits, but it is very difficult for the women to, some of the women to accept these treatment, hormonal treatment, while some new preparations like Yasmin contains drosyperinone. It's very helpful, and helps also in the pill-free intervals, and with the increasing intervals these newer agents are likely to be helpful. And then comes the danazol, but it has the masculinizing side effects, though it gives a relief in the moderate to severe PMS. Then the GRN analogs, but the problem is the same, that with them they have the continued use, like for more than 3 months. Add-back therapy has to be added, otherwise they affects the bone marrow density, and so for prolonged they produce problems of severe osteoporosis. So they can be added tibolone, also an element of SERMs, serum estrogen modulators. And then we have the options of, since there is a diaphoresis, a psychological symptomatology complex, like depression, anxiety, tension, anger, and out of selflessness, out of control, persistent headaches, and decreased concentration, and hopelessness, helplessness. For these we have got the SSRI, selective uptake inhibitors, and SN reuptake inhibitors. They are very good, but some of the women, they unlikely to accept these antidepressants. They are tricyclic antidepressants, anxiolytics, and all antidepressants, tetracyclic, tricyclic. They are very, very helpful, but depends upon the individuality, acceptance. And then we have the surgical options, and surgical options have, you see, the mostly are the ovarian triggers, so, and the uterus, the hysterectomies. So the ovarian trigger has to be removed with the uterus. Total abdominal hysterectomy, the bilateral removal of ovaries, with the addition of the hormone replacement therapy and the add-back therapy as well. So, but for that GnRH test is confirmatory, and that has to be performed. So it's also an indication for that has to be for the effectiveness of hysterectomy. And then there are other drugs and agents. They are available. Dietary nutrition. These fats, salts, and they carbohydrates, they have to be reduced. Spices and all the pills, and the smoking and the alcohol, all they have to be. Walk and exercise and healthy lifestyle with good drinking amount of healthy water. And then another thing which is very also important are the minerals and vitamin B6, B1, B12, especially B6, thiamine. And then we have calcium, addition of calcium, magnesium, and phosphorus, and all these minerals and vitamins, they are an additional benefit, especially the calcium and the vitamin D as well, as of joint and muscle pains. And then comes the other meditation therapies, cognitive therapies, exercises, stress reduction therapies, and we have to all address all these yogas, hypnotherapy, homeopathies also, and some vital dance and white text. They are herbal preparations are very effective. Some phytoestrogens and some progestogens in the progesterone, but that has to be difficult to be adjusted in the Western diet. So all these mayors, yoga, hypnotherapy, music therapy, relaxation therapy, reflexology, photo sessions, and magnotherapy, and all others, they are implicated in it, and they are used, and they are very, very helpful, and with the healthy lifestyle and combination of all type of acupunctures and hypnotherapy, and all these sessions, they are taken and they helps a lot with the counseling and all this, and stress relieving and stress reduction exercises and stress reduction measures, both psychological and antidepressant and anxiolytics and tetra and tricyclic antidepressant. So we'll give within this is a review we have given, and we have to maintain a symptom diary, and then we have to make a symptom complex from the charts by the Pakistan International Monitoring, this premenstrual societies, and all these complexes, complex treatment strategies and aspects, they are being utilized to readdress this premenstrual syndrome, a very important, distressing, diaphoretic and disrupting disorders for the females in severe PMS, leading disrupting their normal activities, daily lives, and their concentration, and making them distressed. So the reduction in smoking and alcohol also to be tamed. We will come with another brief review, and takeaway lesson is pray, praise, trust, love, walk, talk Allah, and find and follow Suasana, the lifestyle Hazrat Muhammad sallallahu alaihi wasallam, our health and survivor. And we must not forget our glorious past. दुनिया में इनकी ठोकर से सहरा व दरिया, सिमट कर पहाड़ इनकी हैबत से राई। अल्लाहुम्मा अजिरना मिनन नार वक़फ़ा बिल्लाहि वलिया वक़फ़ा बिल्लाहि नसीरा। सुभान अल्लाह व बिहम्दिही सुभानल्लाहिल अज़ीम। अल्लाहुम्मा इन्नी ज़िक्रक शुक्रक व हुस्न इबादतक ला शकरतम ज़ैदनकुम। And we must thank and trust and love and pray Allah always. And then we continue with this, and always talk and pray for to Allah, and ask whatever it is. That is the only, God Almighty is the only one who gives all these blessings, and all whatever we want, it's being given. So we'll come with another review. Wama alayna illal balagh.